Today our topic is Huntington's chorea. Huntington disease or the HD. This is a progressive or the degenerative brain disorder or also known as neurodegenerative disease. The Huntington's disease slowly diminishes the ability thinking, walking and talking. Chorea or jerking motions, which is a developed symptoms of the Huntington's disease. This is slowly ruins the nerves in your brains. As of the science right now, Huntington is an incurable disease. This disease was first described by Dr. George Huntington in 1872 as a chronic progressive degenerative disorder affecting the movement, cognitive function, and the personality. Huntington disease is caused by the abnormality of the fourth chromosome and the H3T gene, and the gene makes a defective protein. This flawed gene holds the blueprint for the defective version of the protein Huntingtin. The Huntington gene defect also has the 40 repeats of the genetic code, unlike the normal gene that only has the 70 to 20 repetition. Here, what part of the body are affected is, they affect only neurons, that is a brain cell, eyes and the muscles by destroying the interneuromotor and the sensory neurons. Etiology and the pathophysiology. The inherited disorder consider the autosomal dominant, progressive atrophy of the basal ganglia and some portions of the cerebral cortex. They appear during the middle adult years. Onset is usually occur between the age of 30 to 50 and the death usually follows the 12 years after the onset. Pathophysiology of the Huntington disease is MHTT will cause the decaying of the neurons in various regions of the brain such as the basal ganglia, frontal and the temporal lobe. The basal ganglia is responsible for the motor function control and the cognition and the emotion and the learning. Signs and symptoms are, they have the memory loss, disorientation and the eventual dementia. People may also have the uncontrolled jerky movements of the extremities, trunk, face or the they also have the disorganized gait, uncontrolled periods of the anger, hesitant or the explosive patterns of speech, grimacing the facial movements, impaired chewing and swallowing and the incontinence. Here we can look for the exam or the test. There will be the exam or the test for the Huntington chorea. There are the tests to see if you have the genetic mutations of the gene and how many repeats are within the HTT gene. The therapeutic interventions, people may also have the control of the jerky movements with the phenothiazines, butyrophenones and the thioxanthines. Reserpine may be used to decrease the presynaptic dopamine and the tetrabenazine to reduce the dopaminergic transmission. People may also have the symptoms which are treated as they occur. Here we can look for the treatments. Deep brain stimulation, a procedure in which the miniature electrodes that release the pulses of the electricity they are implanted into the brain. This treatment may prove useful for reducing the symptoms of the uncontrollable movement known as the chorea in the patients with the HD. Atypical antipsychotic drugs also have been proven to help with the chorea. Here we can look for the dietary plan for the Huntington chorea is to avoid the tyrosine foods which has like red wine and aged cheese, antioxidants, blueberries, phytonutrients, high calorie snacks and the nutrient dense foods. We should give the neurologic status noting the uncontrolled movements and the cognitive ability, and we should also have the family history of the Huntington's chorea. And the nursing care of the clients for the analysis and the diagnosis is risk for the aspiration, body image disturbance, bowel incontinence, chronic confusion, risk for injury and the altered role performance. Planning and the implementation, provide the emotional support for the patient and the family, allow the family and the patient to express the feeling about the progressive deterioration and the ultimate death. Encourage the family members to seek the genetic counseling, modify the environment to increase the safety, assess the ability to swallow, provide the nutritional support as needed. Encourage the patient to remove as active as possible, provide the respiratory support based on the changing needs of the patients by airway, sectioning and the oxygenation. Remain free from the complications of the immobility, modifies the activities to prevent the injury, and verbalizes the feeling with the family members and other members of the health team. Encourage the family members to seek the genetic one. Here the diagnostic tests like HCT scan, MRI, PET isotope, positron emission tomography, scan for the brain, DNA testing for the chromosome 4 defect. Thank you.